CureDuchenne was founded in late 2003 after our son Hawken was diagnosed with Duchenne muscular dystrophy. And we had searched that first year trying to find an organization that was really focused on research. We really wanted to find a cure for this disease and decided that we would probably be best served to start fresh and really start an organization that was focused on funding the most impactful research and identifying early science and funding that. So that was the model that we started off with, and it quickly evolved into a venture philanthropy model, understanding that if every single family that is affected by Duchenne did marathon runs and bake sales, there still would not be enough money to walk some of these research projects through the clinical trial process. So we started investing in companies, and not large amounts, relatively speaking, compared to the cost of an overall drug development program, but enough to de-risk the science early on. And we were able to apply our deep scientific knowledge with our advisors and who had come out of pharma, so they knew the drug development process. And so because of that, we were able to pick some really good research projects, one of them being Sarepta, way back in 2010. And they were not getting much support from the Duchenne community or investors. And so we took a chance because we believed that exon skipping had some promise, and we, along with another organization, Foundation to Eradicate Duchenne, put just enough money in for them to complete a toxicology study so that they were able to proceed with their clinical trial. And it wasn't a straight line, but they did become the first company to have a drug approved for Duchenne in 2016. So we were really proud of our early contribution to that project. And now that the rest is history, and it's easy to see that because of that one approval, they were able to invest heavily and now have what looks to be a very promising gene therapy program. So those are the types of early stage investments that we make. Another one was with Bamboo Therapeutics, and we put a little bit of money to help them plan their clinical trial. And Pfizer bought them shortly after that. And again, this is another company now that is in clinical trials for gene therapy for Duchenne. And we haven't seen the results from that one yet, but we're remaining very hopeful that it will also be very impactful. Another example is a company called Exonics Therapeutics, which we, when CRISPR came out, and we thought this looks like it has a lot of applicability for Duchenne, and so we did a lot of research with the scientists that were working on muscle at that time and CRISPR, and settled on Dr. Eric Olson at UT Southwestern. And we actually co-founded a company with him called Exonics Therapeutics. And he has seen dramatic results in the animal models of Duchenne, restoring 50% dystrophin in the skeletal muscles and 90% in the heart. And it just kind of goes on and on. Another early investment that we made with Nationwide Children's Hospital, just last Thursday it was announced that Adentes is licensing that program to take it forward for particular mutations within the Duchenne gene. And again, just yesterday there was another announcement that AskBio received a very large investment, and that was a company that we invested, again, a small amount of money early on, just to accelerate their Duchenne program. So, as you can see, we're constantly searching for the best science, and even though we do have an investment in these companies, and the return obviously is important so that we can go and fund more research, first and foremost is the science and how important.